Welcome back, everyone. In this video, we talk about the best treatments to cure sciatica that all of you can do at home, so stay tuned. Hey everyone, my name is Dr. David, and in our channel we provide awesome tips and tricks to improve your range of motion, decrease your pain, improve your strength, and improve your ability to move. If that is something that interests you, make sure you subscribe to this channel and definitely click on the like button so that helps YouTube promote it. Everyone who walks into the clinic tells me that sciatica is the worst thing they've ever experienced. I've had people come in and say they've had more pain with sciatica than they did giving birth. Now, I would have no idea what that means, but that is what I'm told in the clinic. I've had people coming in crying and sobbing. I've had people coming in not able to move, or if they go onto the table, they can't get up. It is truly a paralyzing injury that people deal with. And before we get into how exactly to cure it, I'm going to talk about exactly what it is, how it develops within people, and how to relieve your pain when you get it. So this is going to be super exciting. Pay close attention and make sure you watch until the end, because I'm giving the exercise part of it at the middle to end, where we're going to talk about all the best stretches to get rid of it. Guys, if any of you have ever dissected the sciatic nerve in a cadaver of a human body, you would understand why sciatica is what it is. The sciatic nerve is the largest nerve in the body. It supplies the entire lower leg. It's about that thick, and it has several branches that come off of it. And so that's why when it's compressed from either a herniated disc or something else, and it gets irritated, it affects the entire lower leg. And that's why people will say it feels like there's a knife just shooting down the leg. Or it causes a lot of numbness and tingling because the nerve creates a sensation to your leg. So if it's compressed, you'll get less sensation and therefore more numbness and tingling. So let's talk about a few presentations of a typical sciatica patient, and that may be you watching this video. Presentation number one, someone picks up something really heavy, a laundry basket, something at work, turns and twists and feels that pain right away, gets worse that night, and then it goes down the leg. Very, very typical. Way number two, you just wake up in the morning, can't remember anything specific that happened the day before, but you all of a sudden have numbness and tingling down the leg, or maybe even sharp pain down the leg. Way number three, it just slowly comes on after time. It starts off with localized low back pain that slowly starts to radiate down into the buttock, and then finally down into the back of the thigh and into the foot. And then way number four, a lot of people who are pregnant happen to have sciatica, both during the pregnancy and then after they give birth, with a lot of the lifting back and forth with the baby, that also tends to worsen that sciatic symptom. So those are four major ways that sciatica typically present. Although there are others as well, those are probably the four most common. Really common question I get in the clinic is, David, should I be getting an MRI when I feel this pain down the leg? And so the answer really is this. Is the MRI, you have to really ask yourself, is the MRI gonna change the way that I feel? And the answer is usually no. And so let me explain a little further. If you just woke up with this pain, try conservative care first, because after about 4 to 6 weeks of conservative care, if the symptoms aren't improving, that's a time to consider going to see your doctor, getting imaging, because if it's not going to change your course of treatment, then there really is no point of the imaging. And all the research really shows with low back pain and even sciatica, conservative care after 4 to 6 to 8 weeks for the first 2 months since you've had the condition really helps relieve the discomfort. Now, as we said, sciatica typically starts because there's a herniated disc putting pressure on the nerve root in the L4, L5 area, which then radiates into the sciatic nerve and then eventually down the leg. And so the question is, how do you actually know when you're getting better? It's not so simple like it is in the shoulder or the ankle or the hip, where as your pain decreases, you're getting better. But there's a term called centralization of symptoms when it comes to sciatica. Centralization of symptoms mean that the symptoms that are going down the leg slowly start to creep up the leg. So if they were in the foot, maybe now they're in the back of the thigh. If they were in the back of the thigh, now they're in the glute. If they're in the glute, they're in the back. And actually, even if your symptoms are way worse in the buttock area or in the back as they come up than they were before, but the symptoms are still coming up, that's actually a sign that you are doing better. Even if your symptoms are worse, as long as they are centralizing, that is considered, according to all the research on sciatica, that you are actually improving. All right, guys, homework time. It is so important in order to treat sciatica to first determine what is making your pain worse. Sciatica is generally treated based on two different directions. One is the direction of bending forward, and the second direction is the one of extending backwards. So before we even get into a cure or a treatment, we have to talk about the different patterns of treatment and how to know which one is going to be effective for you. So listen carefully to this. If you don't get anything else from this video, listen very carefully now. If your symptoms are much worse when you're sitting or bending, that is considered a flexion-based pattern. So for those specific treatments, and that is typically, by the way, what you're going to find if you have a herniated disc, and for 90 to 95% of people with sciatica. If you have increased pain with those movements of flexion, sitting and bending, we're going to treat it with the opposite approach. So remember that when we get into the exercises. That is 90 to 95% of people with sciatica. If you're in a situation where you have more pain with extension, with bending back, or when you're standing and walking, we're going to treat it the opposite direction. Now you may be saying, I don't know when I have pain, David. I have pain all the time. I've got pain when I'm sleeping, when I'm walking. It's acute. It's super painful. How do I know which of these approaches I should take? And so what I would recommend is bending down and touching your toes 10 times and then extending backwards 10 times. And seeing which is the direction that causes you the most pain going down the leg. Not the most pain in your back, but the most pain going down the leg. If you notice a difference when you bend down versus when you arch back, that's the approach you want to take to treat this condition. Exercise number 1, if you have pain going down the leg when you bend down and when you sit, is called a lumbar extension. Really easy to do, really effective. And so you're going to brace your low back and then slowly start to extend backwards. Don't try to go too far forward with the hips. Just try to extend right back with the back and slowly ease into it. It's probably going to be really stiff, but just slowly ease into it and see as you do it if the pain starts coming up from the bottom of the foot or wherever the sciatic symptoms are for you. And just easing into it about 10, 15, 20 times. If the pain starts to get worse down the leg as you do this, you got to stop. But that's what I'm saying. Slowly ease into it. And then as you're doing it, you can start going a little bit further back if it starts to feel better as you're doing it. Very common exercise for sciatica. Exercise number 2. If you have pain going down the leg when bending, sitting, and that flexion-based pattern we talked about, we are going to do a prone press-up. So you're going to start with this on your stomach and just going up onto your forearms. So you're putting some nice extension into your back. This usually will feel stiff in the low back, but it should not increase pain going down the leg. And just hold this for about a minute and do it a few times. Now after doing this for 1-2 days and you feel like it's starting to get better, a progression is you're going to slowly come up like this, right through your hands. So you're getting some nice extension in your low back and then come back down. You can go up and then come back down about 10 to 15 times. As a further progression, once that starts to improve and the pain is coming up the leg, centralization like we talked about before, then we're going to come on up and hold it for a good 10-15 seconds and then come on down. Now, like I said before, this is going to feel a little bit stiff in the low back, but that's okay if the pain in the leg is improving. Because that's the difference between sciatica and regular low back pain. It's a neurological issue versus a musculoskeletal issue. Back and forth. Now, this is also a pretty good arm workout, so definitely be sure to take some breaks if it's a lot on your shoulders. All right, guys, we did a bunch of exercises to work on extension to get that pain to centralize up. Now we're going to do another type of exercise, which are called sciatic nerve glides. And that's basically flossing that sciatic nerve through the tracts. And so what you're going to do is take a seat in the chair and start with your head down, your chin down. And as you extend the leg, you're going to bring the head up. And then back down. And head up. And so you're actually stressing the nerve on one side and slacking it on another one. And this is just a great way to increase the neural mobilization. And I would do it about 20 to 30 times. If you start to feel increased pain with it, then I would stop. But if it feels good, like a stretch, then I would continue. Now, there's not such great research with these neural mobilizations, these sliders as they're called, but I have found them to be pretty effective in the clinic, so I would recommend at least attempting it and seeing if it helps you. If when sitting down you were having too much pain doing those sliders, another modified way to do it is on your back, where the weight of gravity is off and you're just supported by the floor. So this is a more acute situation. You just bring the knee up, hold it with your hands, and then bring the leg up till you feel a stretch. Toes up, toes down, back to neutral, and come back down. Again, up, toes up, toes down, back to neutral, and come back down. It's just a lot easier than doing it in the seated position. And about 20 to 30 times on the side where you're feeling the sciatic nerve pain. All right, guys, 2 exercises definitely not to do when you have sciatica that a lot of people are given, which ends up worsening your symptoms. So make sure, look, part of the treatment with sciatica is not only what to do, but also what not to do. So these 2 exercises I would hold off until your symptoms start to improve and you don't have that shooting pain down the leg. The first one is a glute stretch, a figure 4 stretch, where you're bringing your knee all the way up like so. That puts a lot of pressure and tension on the sciatic nerve that splits right through your glute area. So that's an exercise I would avoid doing. The second exercise that a lot of people are given are the hamstring stretch with the strap, where you pull all the way up, and that's literally doing a provocative motion to that sciatic nerve. Do not do that exercise if you're having sciatica. Make sure if you really want to stretch that hamstring, put a bend in the knee so you slack the nerve, and then you can do some lighter, more modified versions of it. Another really good exercise to do is a bridge. I'm not going to show it here. I've showed it in videos before, so see the link in the description above and below. But a bridge is another good exercise if you're having pain when you're sitting or bending. So those are 2 exercises not to do and 1 exercise that you should consider doing for sciatica. Guys, I want to provide you, for the people who have stayed watching until this point, 2 bonus tips on what to do with sciatica. Bonus tip number 1, it's really important to loosen up the mobility in your hips and your mid-back. I am not going to go over a whole bunch of exercises with that because I've shown it in several other videos. So I'm going to link to those videos in the description below and up above over here. Those are awesome to do. Even when you have sciatica, it shouldn't really affect it. As long as you're not turning and torquing the low back, but you're stable in the low back and you're working your mid-back and your hips, those are awesome exercises to do even when you have sciatica to improve mobility above and below that sciatic area. Bonus tip number 2 is lifting mechanics. It's so important that you guys are lifting things in your house or at work the correct way. So I'm just going to give you A, B, and C right here. A, make sure the object that you're lifting is as high up as it can be. The lower down, the more pressure on your low back. B, make sure that when you're lifting an object, it's as close to your body as it can possibly be. Make sure you're not outreaching with your outstretched arms. Make sure the object is as close to you. Get right up to it when you lift it. This is just pure physics. And C, when you lift the object, make sure you don't lift and then twist to put it down. Make sure you lift, turn your body, and then put it down. Make sure you're not twisting through your low back. That physics-wise is the worst thing you can possibly do. So this is not only to improve your pain, but also to prevent recurrences of that sciatic pain. Guys, thanks so much for watching. I really appreciate it. Hope you enjoyed these tips on how to get out of sciatic pain. If you have any questions or comments, definitely leave them down below. And if you enjoyed this video and want to see more of these types of videos, definitely hit the subscribe button, and we will see you next time. Have a great day.